I take care of a lot of women and their families. They often have a lot of questions, joint pain and brain fog. Can you tell us exactly what a rheumatologist does?
Rheumatologists are practitioners who specialize in really the identification of autoimmune conditions. We identify if your immune system, the part of our body that fights off infection most typically, is starting to attack the inside of our own bodies.
Hi, this is the Care Room with Dr. Cindy. Welcome. It's a space that was created just for you. I'm your host, Dr. Cindy, and this is a chance to get up close and personal with me. We're going to talk about the things in medicine that matter to you. We'll talk about the questions you've been carrying. We're going to have some honest conversations. We're going to hold space for joy, struggles, and everything in between. It's care that goes beyond the exam room. Care you're going to take home with you, whether you're listening while you're driving or you're listening while you're exercising. I promise that it's going to be care that's rooted in truth and a deep commitment to walking with you every step of the way. I'm glad you're here. Hi, everyone. This is Dr. Cindy here on the Care Room. Today, I have a very special guest with me, Dr. Brittany Panico. She's here. She's a rheumatologist. And before I kind of mess things up, I'll just let her introduce herself.
Well, thank you so much for having me. So, I am Brittany Panico. I'm a board certified rheumatologist. My primary office and location is Summit Rheumatology in Arizona, but we also have locations in Colorado and Oklahoma. And yeah, I'm really excited to talk about, questions related to rheumatology. I know when people think about, direct care, so I actually do take insurance at my practice, but a lot of people have a combination of both things. So,
Right,
I think specialists, right, like as we kind of
right.
identify the more patients in the direct care world, sometimes it's harder to find direct care specialists, but
Indeed.
yeah, so
Indeed. But we're
thanks
so
for having me.
Of course, we're so happy that you're here, Dr. Panico. So, I
My
just have
pleasure.
a few questions. So, as you know, I am Dr. Cindy. I take care of a lot of women and their families. They often have a lot of questions, especially as it relates to like joint pain and brain fog. So, my first question to you, just so you know, the patients listening can actually know what you do and how you can help us. So, can you tell us exactly what a rheumatologist does?
Absolutely. Yeah. So rheumatologists are physicians or clinicians, practitioners who specialize in really the identification of autoimmune conditions. However, we don't see all autoimmune things.
Right.
So it does get a little bit sometimes the semantics get a little bit intertwined, but we identify if your immune system, the part of our body that fights off infection most typically, is starting to attack the inside of our own bodies. And sometimes we see it on the outside with rashes
Right.
or like psoriasis or even lupus can present with skin things or
Sure.
what we call vasculitis. So sometimes we physically see it, but a lot of times patients have a lot of underneath sort of hidden or what we consider like invisible symptoms like fatigue or joint pain, where you might not look at a person and think that something is wrong necessarily. And so we rely on a lot of blood testing to help give us clues. We rely on physical exam. We rely on talking to patients about what their medical history is, about the way that their body feels on the inside. So we're kind of detectives in a way about trying to decide, the way I kind of approach it with patients is, am I going to be able to offer you a medication or a treatment that can fix the things we're talking about? Or do I need to figure out another type of specialist maybe who can help sort through some of these things? And sometimes it's a combination of both. Sometimes with lupus, for example, that's one of our biggest conditions that we see that encompasses needing oftentimes a kidney specialist, sometimes a lung specialist, sometimes a heart specialist. Sometimes, you need multiple people involved. And so a lot of times we're deciding all those things at once.
Right.
But ultimately, we identify if you have what we consider an condition. And then also, my clinic specifically, in particular, we have a very big focus on gout as well.
Oh,
And we're realizing that there's a big family dynamic when it comes to gout, that a lot of people will have a big family history. And even women are presenting as what we think of as like, joint pain or maybe some hand arthritis, and we're diagnosing women more so with gout. So a lot of people
wow.
don't know that rheumatologists do that, but my
Right.
clinic and myself,
Sure.
I have a passion for gout, and so we do a lot of gout treatment too.
Sure. Yeah, that's interesting. Yeah, because we typically see gout with men, but um, that's really interesting that it's happening with women as well. So, can you
Mhm.
tell us more about the most common autoimmune conditions you would see in women um, between the ages of 20 to 50? You mentioned that you see a lot of, or that's a lot of what you do, those autoimmune conditions.
So our most common one is rheumatoid arthritis,
Okay.
and that usually has sort of like a phase where it can present early on in younger folks, and then later on, kind of after menopause, it sort of can make a comeback. But
Yeah.
we're seeing it across really any age or spectrum. There's really not, I think in medicine, we learn a lot of things that aren't totally true all the time, right? We kind of think it clusters. And geographically, things cluster too, which is really interesting because you're in the east, northeast area, I'm in the southwest, and we see
Right.
things in very different presentations. My clinic in Oklahoma sees things differently than I do here in Arizona. So
Right. Right.
a lot of times geographically, that does make a big difference. So, rheumatoid arthritis is very common. We see a lot of what we call positive ANA, and I'm sure you can,
Yes.
attest to this, right? As we start going down the rabbit hole of checking labs, and people are like, "Well, what is this?" Right?
Sure. Mhm.
So, and I can answer as many questions as you want, but the short end of that version is we decide or decipher based on what you're talking about as a patient, what you feel, what's happening to your body, whether or not that means lupus or a connective tissue condition, or that means something like psoriatic arthritis even can have a positive ANA, or something like ankylosing spondylitis. So
Okay.
there's lots of reasons for a positive ANA. So I group that together because that kind of gets people in the door, but
Right.
it's not truly a diagnosis by itself.
Health. Right.
Um,
Right.
and then um, so I used to live in Chicago and practice in Chicago. We saw a lot of what we consider or we call polymyalgia rheumatica.
Okay.
That typically presents in older females after menopause or after the age of 50 and can present as really sudden, like abrupt onset of intense pain and stiffness in the shoulders and hips. And
Okay.
sometimes can involve the back of the neck, between the shoulder blades. You can have headaches with that. So that sort of seasonally fluctuates
Right.
based on my experience with that condition. There's a little bit more sort of uptick in that in colder weather times of the year than during the summertime, and we don't fully understand why. And then we see a lot of, I think in rheumatology, we don't treat Hashimoto's, but
Okay.
we see a lot of patients who have Hashimoto's and then come to us for, questions about why their body might feel the way they feel. So, things that cluster with Hashimoto's can be Sjogren's disease,
Okay.
different other connective tissue conditions. So, it, it's hard to say the most common because we
Or
just see
a wide range.
all,
Yeah.
yeah, a wide range of things. But I would say like across the board with what, we see particularly is more rheumatoid arthritis,
Sure.
where, and what that means is where your immune system starts attacking the lining of your joints. And so typically people have like stiffness in their fingers, maybe
Sure.
toes or wrists. But it can move on to big joints too. It can move to the shoulders, elbows. So.
Sure. And then, when would you say you would get concerned, or when should say I'm a patient and I think I might have rheumatoid arthritis, what would my next step be?
So anytime you physically see swelling,
Okay.
so in your knuckles in particular, where you feel like it's harder to bend or grip,
Okay.
where there's like a change in the way your ability to manipulate your fingers or move your hands, or
Okay.
there's all of a sudden like we kind of say pain, but it can be very subtle stiffness where you're kind of dropping things, or people will say, I'm having a harder time holding my coffee mug, like gripping it and twisting, or pouring things like holding a pan to cook, right? Doing some kind of motion where your wrist has to go up and down or sideways, that motion might start to become really uncomfortable. And it's something that progresses and lasts. So 1 to 2 days of feeling kind of sore, we think, oh, maybe I'm just a little bit more
Right.
achy today.
Right.
But if it's progressing and there's visible swelling where you're kind of like, my hands are a little puffy and
Yeah.
this, I'm not really squeezing, or it's taking a lot more effort, or getting up out of bed in the morning is like really, I have to like get myself going.
Sure.
So like changes in the way you perform your daily habits is a big
Okay.
indication that something
Oh,
is different, because we all sort of go through phases where it's like, well, I'm a little bit more tired and it's harder for me to get up,
sure.
right? Like in the winter, specifically when it's dark, right? We
Sure.
don't necessarily want to
Want
get out
to-
of bed when it's still dark, but that
Guilty.
doesn't necessarily mean that doesn't necessarily mean that there's something wrong with you,
Right.
right? But if you're really struggling, like let's say your morning routine was 20 minutes
Mhm.
and now all of a sudden it's taking you an hour to like get yourself dressed and get yourself, going, that's a big change that happened. And so that's something to raise, concerns or questions of like, maybe I should start to be tested for something.
Or something.
Or two, and I'm not a huge advocate of taking over the counter stuff to try to fix things yourself, but I know a lot of people will try Tylenol or Aleve or ibuprofen. And
Right.
if you do those things and you know what that makes your body feel like, right? Like if we're all a little, if we're kind of achy and you take an Aleve, you know what happens. But
Hmm.
if you do those things on your own at home and you're like, this is not working, and it's been like days,
Right.
you're kind of going on like a week or 2 weeks and you're just not feeling like you can shake that feeling, then
Sure.
it should kind of peak awareness of like, maybe something is going on.
Sure.
And
Sure.
I think too, I think a lot of people, especially busy moms, right? I am a mom of three. I totally get, the daily hustle.
Sure.
But I think sometimes we as women tend to kind of have well, I'm really nervous that somebody's going to tell me something's wrong.
Right.
Like I don't want to go to the doctor because I'm afraid of what they're going to tell me. And my suggestion to that is, we're not trying to scare you. We're not trying to make things hard,
Right.
but a lot of conditions, especially that I see as a rheumatologist, are treatable. So
Right.
when we treat early and we get you on a plan that can be medication, a combination of diet changes, lifestyle things, then that gets you back to where you want to be and where you're feeling good about yourself. But the more you struggle and the more you kind of push through that, and the more, it starts to eat at you,
Right.
it's harder to come out of that,
Right.
right? It's harder to pull out of
Right.
those, deeper periods than having a conversation of, my body doesn't feel right. What might help it, get back on track? So I think, if you're not afraid of being given a diagnosis, then that allows you to accept healing and
Right.
start that process of feeling better. So I always tell people, once you meet me, I'm not scary. I'm not, we're not, we're not doctors who are like, you gotta do this or, or
Right.
else, because the reality, right, is like you're making a choice to come in. You're making a choice about your health. And I think, folks like you and me, we just want you to feel better. We want, women encouraging women, right? Like
Right.
we get it. We want everyone to be doing well. So,
Right. We're here to help, certainly.
yeah.
Yeah, thanks for that, Dr. Panico. The other question I have, and what I tend to see a lot of is, like you said, we're moms, we're women, we're busy, but a lot of fatigue. And we, have, in this medical world, this diagnosis of chronic fatigue syndrome. There's another diagnosis that, us docs struggle with fibromyalgia. Um, how do you differentiate between that and, like someone who's coming in with symptoms suggestive of RA or rheumatoid arthritis? How would you?
Yeah.
I know I'm kind of putting you on the spot here, but how would a primary care doctor like myself, a patient comes in, she's very tired. She's talking about, she's having joint aches and, body aches. It might be pain, it might be burning. She's, just wants an answer. How would you differentiate between those?
Yeah, that's a great question. And I think we're all in very similar boats
Yeah.
with this. And I think the biggest thing for me is to recognize or question if anything suddenly changed.
Okay.
Because with autoimmune syndromes, there was I'm doing pretty good. I'm living my life. I might not be feeling great, but I'm living my life. And something changes. And then you can't do those things anymore. And it gets worse and worse and worse and worse. Whereas fibromyalgia or even chronic fatigue, and I want to differentiate because fibromyalgia tends to be a diagnosis when we don't really find a blood test abnormality. However, patients who have what we call ankylosing spondylitis or even non-radiographic spondyloarthritis. That's a really big medical term for autoimmune. It's like a autoimmune skeletal syndrome. And it's not quite RA, but it doesn't have a blood test attached to it a lot of times. And so differentiating fibromyalgia from, let's say, that is tightness, like tendon tightness, where you might be somebody who, let's say you were, jogging 2 miles a day and you were feeling good with that. To then it really becomes harder to jog 1 mile a day because your body is so tight, right? It's not like stretching. I mean, stretching might help, but there's a change in the way you're able to do activity. And that change can be driven a lot of times by the immune system, and it can be really hard to figure that out because this happens a little more gradual than sudden.
Sure.
Whereas fibromyalgia is more of the way I describe it to patients is it's a nervous system on a dimmer. It's your nervous system on like a dimmer switch. So when we have a rock in our shoe,
Sure.
our foot, our toe, our foot tells our brain that there's something bothering our foot. So we take our shoe off, get the rock out of our shoe, put our shoe back on, and that stimulus goes away. That signal is turned off, and you're not really thinking all day about that rock in your shoe. It's like, I took care of that. It's you probably wouldn't ever think about it again until it happens later on, right? But fibromyalgia is your body reacting to a sensation that isn't removable. You can't pull it and
Mhm.
separate it from your body. And it goes up and down on a dimmer. So the longer that sensation lasts for you, the higher that dimmer, that brightness gets so that it's occupying your thinking all the time. And then it starts to kind of spread to other parts of the body where you're just like, I'm just in pain, I'm in pain, I'm in pain. And the cycle of not sleeping well because you're uncomfortable.
Right.
When we're tired and frustrated, we typically don't make the most healthy food choices, right? It's really easy to just eat what you can grab because you don't feel good,
Right.
than cook, a healthy meal when you don't feel well, right? We all know that.
We're all guilty.
So when you get in this cycle, right, of like unhealthy eating,
Sure.
a lot of processed, chemically laden, chemically packaged food,
Sure.
and then you're not sleeping, your nervous system is just like on alert.
Mhm.
So nothing you can do is going to make you feel better in the moment, right? If you try to exercise, the effort to try to just like get yourself dressed in the morning is so intense. The effort, to do things. And it starts really like carrying a big load for your nervous system.
Right.
Whereas autoimmunity is like, I'm trying my best to do the thing and my body will not let me do it, right? I want to drink coffee so bad every day, but I can't. I had to buy a new kind of coffee cup because I can't grip my favorite mug anymore. So I modify the way I do my normal habits, but my schedule for the most part kind of stays the same because I got to do it, right? But fibromyalgia just becomes this load that we carry where it's like, I just can't, everything is overwhelming. And we don't know why it happens. We don't know what causes it, but I really do. I just finished, and I think it's a excellent book for anybody who's going through health related issues. Oprah, and a psychiatrist wrote a book together called What Happened to You?
Okay.
And it's a book about understanding our childhoods and how we were raised and
Mm-hmm.
how we communicate the way that we feel and communicate our needs to the world.
Mm-hmm.
So if there was some kind of trauma in your life,
Mm-hmm.
that is a big force of why we develop habits, why we develop communication styles, why we act the way we act. And not very many of us are really digging into like, what's different about your life, right? So with fibromyalgia, a lot of times if we really sit on it, somebody might say, well, maybe I got divorced and now I have three kids all by myself, or a parent passed away and that I was so close to that parent and I'm having a really hard time coping.
Sure.
Or my best friend and I had a falling out and I don't have a confidant anymore. Sometimes there's an event and people might not always be forthcoming about it, but
Sure.
sometimes if you pinpoint, was there a big life event? There's ways we can ask, was there a big change that happened for you that maybe started changing the way your behavior, how you live your day or
Okay.
go through your day? Sometimes we can pinpoint things like that.
Sure.
And that's more of like a chronic pain kind of syndrome than that autoimmune switch where your immune system, and they do kind of lead in together. We do think there is a big relationship between prior history of trauma and the development of autoimmune diseases. There's a lot of research being done in that kind
Okay.
of trauma awareness community.
Sure.
Um, but a lot of times, I fatigue is something I think we're all battling,
Right.
right? I think we all want to do so many things in a day and we're all being pulled in so many directions. And
Mm-hmm.
our computer, I kind of equate it to like, your browser. Are you somebody who has 50 things open or are you somebody who
Yes.
has two,
No, I'm fit.
right?
Yeah.
So I have a lot going on, but all those browsers are thinking behind the scenes. So
Right.
all that mental energy of you reminding yourself, I have two loads of laundry I've got to get done before tonight. I've got to get food on the table for my kids. I've got to book my own doctor's appointment.
Right.
I've got to do this. I've got to do this. And when we're reminding ourselves that over and over and over and over all day, every day, and we're staring at computer screens and we're dealing with blue light. Like my glasses have that blue light filter, so it makes it look purple. But
Sure.
when we're stimulated
Right.
all day, right, by all these things we have to deal with, we're checking our phone every 2 seconds for text. We're logging into Facebook to see who updated something. All that mental shifting
Yeah.
is so much energy. And then when we have sugary drinks that have caffeine to perk ourselves up, we snack on things that are easy to come out of a package. We
Right.
forget to have dinner because we're busy feeding our kids and we don't want to eat the junk food, right? So we skip meals sometimes. We forget to drink water. We forget, to nurture ourselves.
Mm-hmm.
That lifestyle, it's not just one day, right? It's a lifestyle
Sure.
really is a lot. Like that's very heavy.
Sure.
And so
Sure.
we start to like not sleep, again, I'm guilty of choosing to scroll through my emails instead of going to sleep.
Yeah.
I'll get into bed, but then I have my phone with me in
Exactly.
bed, right?
Right.
So we tell ourselves, well, I'm getting 8 hours of sleep. But if you calculate it out, right, are
It's
you
not.
are you really? And then My kids wake up in the middle of the night, Mom, I'm up. I need water. So you're interrupted or you have to let your dog out, right? Like there's so many things that we're
Sure,
dealing with
sure,
every single day.
sure,
And we don't really decompress. We don't really get that chance to like come home,
sure,
relax, clear our brains.
sure. I,
So
I guess
fatigue
that,
is it's very real. It's
yeah.
very real in autoimmune syndromes, but it's also just very real for real life. And I think sometimes we have to like assess what is it that's bothering me, right? Is it my inability to stay awake? Like
Hmm.
it's not safe for me to drive because I'm falling asleep at the wheel. That might be a medical issue, right? Like
Right,
sleep apnea.
right.
Or like, am I taking care of my needs? Am I getting enough food and nutrition? Am I getting, enough of something very basic?
Yeah,
And kind of starting there
yeah.
because we don't have like that magic fix to fix fatigue.
We don't, unfortunately. So I guess that
Yeah.
kind of leads to my next question. Like, are there lifestyle, um, things that we can do? You mentioned, getting enough sleep, alternative therapies that actually help. I know you mentioned, like, you put patients into, are there treatments we can do versus referring them to another physician or specialist?
Yeah.
Is there? Yeah.
Yeah. So I think a lot of it is kind of, fundamental things that like doctors can do, right? We can make sure that you're not vitamin D deficient. So
Okay.
sometimes when you have really low levels of vitamin D, that can cause a lot of like energy related symptoms,
Mm-hmm.
or B12 deficient, like nutrition, right? Like uh, we can really focus on with AI, we use this term garbage in, garbage out, but it's the same for our own bodies. If we're putting chemicals in, our body doesn't know what to do with that. So then we're struggling to digest and use that as nutrition. So we really want to make sure, is there a way I can kind of reassess what I'm actually putting in my body?
Sure.
And sometimes like a detox or, getting out of like soda for me is a big thing.
Sure.
I limit how many I will have in a day. I don't tell myself I can't ever have it because it's too hard for me to just not have it. So instead of drinking, a six pack, I have one.
Mhm.
There, I still have my soda, but I'm not overdoing it.
Okay.
And then exercise. I know everybody, especially in primary care, right? It's like diet and exercise is our fundamental, like, are you doing these things? And it's so important to move our bodies because if we're not getting that blood flow, we're not clearing out sort of the buildup of the stuff that we don't need, and we're not really like clearing things out. And for our brains specifically, just like getting out in nature or getting those, endorphins and like
Sure.
elevating your heart rate and getting that blood flowing is actually really, really important. And that kind of leads me to like, a lot of times with autoimmune conditions, people are like, I'm really kind of depressed because I was exercising and feeling good and now I can't.
Hmm.
So that's a sign, right? If you're trying to do all these things and your
Sure.
body's not allowing you to, it's not so much like I tell people, is your brain stopping you or is your body physically stopping you? If your body is physically stopping you, that's a sign
Yeah.
versus we can all talk ourselves out of exercising, right?
Oh,
I've had it on my schedule for 3 months and I haven't done it, right? We can talk ourselves out of it versus a physical ailment that we can't manufacture a change for. So sometimes it's hard to like admit those things. We all want to think that we're doing it, but
yeah.
what is the reality?
Yeah.
And I think too, like, um, really reassessing or assessing in general what triggers you personally. So, kind of in this book I was talking about by Oprah, they talk about subconscious things that trigger your nervous system to increase like fight or flight. So, if you're in a really stressful environment at work, and your job is really intense and you're just on edge all day, and then you go home and you're taking care of a family that
Mm.
might increase your stress too, right? We love our kids, but it's hard. if you're not ever letting your nervous system sort of recalibrate, that's hard. That's really hard on our bodies. So if we acknowledge like this thing gets me revved up, we can sort of how might I be able to change that or ask for help?
Sure, sure.
And just recognizing that
Yeah,
can help. And those, I mean, those things are all fundamental, non-medical, like you don't need to take a pill to do that. So
sure.
I think it's really helpful even when you have an autoimmune diagnosis, understanding like what your limits are, understanding what your like fundamental, your body's actually telling you
Sure.
because no matter how much medication we offer, right, all of our prescriptions that you see on, commercials for immunosuppressive therapies, it doesn't change your lifestyle, right? It changes chemically inside your body how inflammation is reacting to your tissue, but it doesn't take away the other stuff that might be triggering for you to not feel your best.
Right, right. Oh, Dr. Panico, this was so good. Thank you. So, if I have a
Yes.
patient, yeah, do you do telehealth visits? How can patients find you if they love what they heard today?
So
And
unfortunately,
yeah.
so I have a wonderful team. I have a fabulous team in Arizona. Like I said, Arizona, Colorado, and Oklahoma. So Summit Rheumatology is my
Sure.
practice.
Mhm.
We unfortunately are not doing telemedicine at this time just because of we're going through some growing changes, but in-person visits and yeah, we're accepting new patients in all of our locations. We do have other clinics in Washington and Olympia in West Virginia. I myself am not a part of those clinics directly, but they're part of my overall group. So we have a lot of the same sentiments between our docs and our team members. So if you're in any of those states or areas, we would love for you to schedule a visit.
Sure. And if they want to know or kind of binge on, this knowledge that you have, where can we find you online?
So I have my clinic site, Summit Rheumatology, on Facebook and Instagram, and
Okay.
then myself, my personal pages are Dr. Brittany Panico. So
Perfect.
DR and my name.
And your
Yeah.
name. Perfect. I'm
Yes.
gonna go on myself because I still have lots of questions. But this was so good.
Yeah, and we'll do round two,
I
episode part
know,
two.
I know.
So
That
where
was
we
that was
can,
my next question to you when we get off. Can
yeah,
another one? Um,
yes, absolutely. Yeah.
But thank you so much, Dr. Panico. Guys, stay tuned. We have another episode coming up with another great doc. Again, if you have any questions, certainly feel free to reach out. Check out Dr. Panico on her Facebook page. You can check out Summit Rheumatology as well. And we're just so grateful that she was here with us today. And as she said, we're going to ask her back one more time. All right. Thanks
Absolutely.
again.
Thank you so much.
You're very welcome, Dr. Panico. Take care. Thanks for spending time in the care room today with Dr. Cindy. If you liked what you heard, please subscribe, share this podcast. I'm also on Facebook and Instagram. You can follow me there. Remember, you're not alone in this. There are doctors who do care. The information in this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, treatment, or diagnosis. Always consult your personalized healthcare provider for medical guidance.